Press 2 fingers firmly into the skin just above your ankle bone. Hold for 5 seconds. Now release. If the indentation stays, even faintly, even for a heartbeat longer than your skin should remember, stay with me. Because the exhaustion that has been sitting on your chest every morning for years is not what you were told it was. That dent has a name. It has a cause, and the cause is not your age. Here is the number that changes everything. The lymphatic system inside your body moves roughly 3 liters of fluid through your tissues every single day, with no central pump, no heart of its own, depending entirely on your muscles, your breath, and your skin to keep flowing. When that flow slows, every cell in your body sits in its own waste. And the first symptom is not swelling, it is fatigue. The kind that blood work never explains. The kind that arrives at 10 in the morning and stays through dinner. The diagnostic system made sure you never learned this, because there is no billing code for lymphatic insufficiency, no patented drug to prescribe, and no 15-minute appointment that fits a problem this structural. By the end of this video, you will discover exactly why this was buried, and the specific morning sequence, type-matched to your own symptom pattern, that you can begin today. Subscribe so you never miss what the medical establishment hopes you stop asking about. To understand how this was buried, you have to go back to 1622, to a young Italian anatomist standing in the dim anatomy theater of the University of Pavia, his hands inside the abdomen of a recently fed dog. His name was Gaspare Aselli. What he saw stopped him. Running through the mesentery were vessels he had never seen described in any anatomical text. Not red, not blue, but milky white. They were not carrying blood. They were carrying something else, something the body was actively moving away from its own tissues. He called them lacteals. He published the discovery posthumously in 1627 in De Lactibus Sive Lactates Venis, with anatomical plates so precise they remain reproducible today. He had found a second circulation, a drainage system, a river running parallel to the bloodstream, carrying away what the bloodstream could not. Medicine spent the next 4 centuries pretending it barely mattered. 30 years later, in 1652, the Danish anatomist Thomas Bartholin, working in Copenhagen, finished what Aselli had started. In Vasa Lymphatica, published in 1653, he mapped the full network, between 600 and 700 lymph nodes scattered through the body like filtration stations, vessels finer than a human hair running just beneath your skin, all of it converging upward toward the chest. And here is what he documented that your doctor was never trained to act on. This entire system has no pump, no heart, no central engine. It moves only when you move. It drains only when you breathe deeply. It pumps only when your skin is stretched and your muscles contract against gravity. The system has no heart. It has only you. Stop moving, and it stops moving with you. By the late 1800s, a Belgian surgeon named Alexander von Winnevarder was treating chronically swollen, exhausted patients in his clinic with nothing more than slow, light, directional pressure on the skin, restoring drainage by hand with no instrument more sophisticated than his own fingers. His clinical records documented measurable improvement within days. Decades later, in 1932, in a small clinic in Cannes, a Danish physiotherapist named Emil Vader formalized the technique into what is now called manual lymphatic drainage. His case files documented chronic fatigue resolving as the swelling resolved, energy returning as the tissue cleared. This is the first twist of the entire story, and it is the engine of everything that follows. The cure for stagnation fatigue was documented before aspirin existed. The answer was already on the shelf. Then the shelf was moved. Now look at what your body is actually doing right now, in this exact moment, as you sit there. Lymph capillaries, vessels so fine they sit one cell layer beneath the surface of your skin, open and close with every step you take. Every footfall is a pump. Every breath is a pump. Every stretch of your skin is a pump. And here is what neuroscience confirmed in 2012, when Dr. Maiken Nedergaard's team at the University of Rochester published the discovery in Science Translational Medicine. Your brain has its own lymphatic drainage, called the lymphatic system, and it activates almost exclusively during deep sleep. The channels widen, the fluid flows, the waste leaves. While you sleep, your brain literally washes itself, flushing out metabolic waste through channels that close the moment you wake. Poor sleep means an undrained brain. The exhaustion you wake up with is yesterday's waste, still sitting there.
Now go deeper into the anatomy, because this is where the story changes. In your abdomen sits a small reservoir called the cisterna chyli. From it rises the thoracic duct, the largest lymphatic vessel in your body, which drains roughly 75% of all the lymph in your body upward through your chest and empties it into the left subclavian vein near your collarbone. The primary pump for this entire upward journey is your diaphragm. Every deep breath you take pulls fluid upward against gravity. Every shallow breath leaves it stagnant. And somewhere around the age of 55, almost without exception, you stopped breathing deeply. Your chest tightened, your posture compressed, your diaphragm shortened its range. The thoracic duct slowed, the fluid backed up, and nobody told you what that cost. Now here is the part you must hold in your mind, because the rest of this video only works if you know which one of these you are. In 22 years of treating lymphatic failure in patients between the ages of 55 and 75, I have seen the same pattern resolve into 3 distinct types, and what restores one type actively worsens another. Type 1 is peripheral stagnation. The fatigue lives in your legs and arms. Your ankles pit. Your shoes feel tighter by evening than by morning. The exhaustion deepens as the day wears on. A short walk eases it. Long sitting destroys it. If you are a type 1, treating your fatigue with stimulants only forces a stagnant system to work harder, and the swelling worsens. The pump cannot answer the demand. Type 2 is central, lymphatic. Your fatigue is in your head. The brain fog dominates. You wake up more tired than when you went to bed. Mornings are the worst part of your day. Your sleep feels shallow, even when it is long. If you are a type 2, treating your symptoms with sedatives deepens the very stagnation that is causing them, because sedated sleep is not the same as deep restorative sleep that activates lymphatic drainage. The brain is asleep. The drainage is not. Type 3 is visceral, cisterna-centered. Your fatigue arrives with bloating. Meals crash you. Your abdomen feels heavy. Your waistline thickens, for reasons your weight does not explain. If you are a type 3, treating your fatigue with restrictive dieting starves the very fluid load your lymphatic system needs to clear, and the stagnation deepens. Identified your type? Keep it in mind. Because what I'm about to tell you only applies if you know which category you are in and what helps one type actively worsens another. One of these is yours. Get it wrong, and you make it worse. Now ask yourself the question your doctor cannot answer. Why has nobody ever pressed 2 fingers into your ankle? Why has nobody ever asked you whether you wake up more tired than you went to bed? Why has nobody ever measured your diaphragmatic excursion or asked when in the day your fatigue is worst? Why has nobody ever traced the heaviness in your abdomen to the system that is supposed to drain it? And here is the answer, and it is the second twist of this story. Recent audits of American medical school curricula reveal that, across 4 full years of training, the lymphatic system receives only a handful of dedicated instructional hours, a fraction of the time given to the cardiovascular system, despite moving comparable volumes of fluid. 4 hours, 4 years. The numbers do not match. There is no ICD-10 diagnostic code for lymphatic insufficiency presenting as systemic fatigue. There is no reimbursable diagnostic test that a primary care physician can order to measure lymphatic function in a 15-minute appointment. There is no patented pharmaceutical pathway. There is no industry sales representative walking into your doctor's office with samples. There is no continuing education seminar funded by a manufacturer. There is no incentive, in any direction, for the system to look. A patient I will call Margaret, 68 years old, a retired school teacher, came into my practice after 8 years of escalating fatigue and 11 different doctors. Each one had prescribed something for a symptom. One gave her stimulants. One gave her antidepressants. One gave her sleep medication. One gave her diuretics. One gave her thyroid medication she did not need. None of them, not one, had ever pressed 2 fingers into her ankle. None had ever asked when her fatigue was worst. None had ever examined her diaphragmatic breathing. None had ever traced her symptoms to a drainage pathway. Her blood work, every time, had come back fine. She had been told, every time, that she was just getting older. That is not a diagnosis. That is a dismissal. And here is the structural truth, the second twist, the one that is almost more uncomfortable than a conspiracy would be. This is not a conspiracy, it is a structural outcome. Symptom-targeting medicine is reimbursable. Root cause restoration is not. A prescription for a fatigue-adjacent symptom generates recurring revenue across decades of a patient's life. A 10-minute morning walk, a sequence of diaphragmatic breaths, and a session of manual lymphatic drainage generate none. The math made the medicine. The incentive shaped the curriculum. The curriculum shaped the doctor. The doctor shaped your appointment. Your appointment shaped your last 8 years. The lymphatic system was not disproven. It was excluded. It was not destroyed. It was made economically inconvenient to investigate. The GP who never tested your lymphatic function is not malicious. They were trained in a system that gave them no tool to do so, no billing code to justify it, and no time in a 15-minute appointment to acquire one. The system isn't broken. It's working exactly as designed, just not for you. It wasn't disproven. It was unfunded. Now here is what makes this truly remarkable, and it is the third twist, and it is the part the diagnostic industry cannot explain away. The proof that this works is not hidden. It is not theoretical. It is not in some foreign laboratory. The research is sitting in the NIH database right now. Dr. Nedergaard's lymphatic findings have been published in peer-reviewed American journals continuously since 2012, with follow-up studies appearing through 2024. The Mayo Clinic has published on lymphatic drainage. Johns Hopkins has documented its role in immune function. Harvard-affiliated researchers have traced lymphatic pathways through the central nervous system. The American medical institutions, the same ones your doctor was trained at, have published anatomical and physiological documentation of the lymphatic system's central role in fluid balance, immune function, and metabolic clearance. The data exists inside the system your doctor works within, and it still never reached you. It is not hidden in some foreign laboratory. It is sitting in the NIH database. It has been cited in peer-reviewed American journals, and it has still never been translated into a conversation your doctor has had with you. MRI lymphangiography can now visualize lymphatic blockage in real time. We can see the stagnation on a scan. The diagnostic technology exists. We just don't look. We just don't order the test. We just don't have a billing code that fits the indication. And here is where the contrast becomes unbearable. While American patients over 60 are being told their swelling is normal aging, German statutory health insurance covers manual lymphatic drainage as frontline therapy, reimbursed, standard, routine. At the Felde Clinic in Hinterzarten in Germany's Black Forest and at the Wittlinger Clinic in Austria, monitored patient cohorts have shown documented fatigue and edema resolution within 3 to 6 weeks of combined manual lymphatic drainage and decongestive therapy. The Scandinavian Journal of Lymphology has published patient outcome data across multiple European clinical cohorts monitored for more than a decade. In Germany, in Austria, in the Netherlands, in Scandinavia, what your doctor has never mentioned to you is the routine standard of care. Hospital-based, insurance-covered, physician-prescribed. The treatment is real. The reimbursement is the gatekeeper. In American practice, manual lymphatic drainage is reimbursable almost exclusively for post-mastectomy lymphedema, not for systemic stagnation fatigue. The therapy exists. The therapy works. The therapy isn't covered unless you've already had cancer. An ocean away, what you've been denied is the standard of care. My name is Dr. James Whitfield. I was the head of lymphatic and vascular medicine for over 2 decades. I am telling you this now because what I watched happen to my patients for 22 years should not happen to you. So here is the type-matched sequence, drawn from the Vater Protocol and the Foldy Clinical Guidelines, the same protocols used in European hospital programs every single day. If you are Type 1, peripheral stagnation, 10 minutes in the morning and 10 minutes in the evening of calf pumping with your legs elevated above your heart, combined with slow diaphragmatic breathing. Flex your feet up, point them down. Repeat, the calf is the second pump of the lymphatic system. Activate it, and the fluid moves. If you are Type 2, central glymphatic, shift to left side sleep, which research has shown optimizes glymphatic clearance. And practice the 4-7-8 breathing rhythm in the 10 minutes before sleep. 4 seconds inhale, 7 seconds hold, 8 seconds exhale. This deepens the sleep that activates your brain's overnight drainage. The brain washes itself only when the sleep is deep enough to let it. If you are Type 3, visceral cisterna-centered, clockwise self-massage of the abdomen for 5 minutes after waking, combined with warm hydration before meals to stimulate the cisterna chyli. The reservoir empties when it is gently asked to, and for all 3 types, 2 universal practices, 90 seconds of dry skin brushing, always directed toward the heart, before your morning shower, and a 10-minute walk before your first meal of the day to activate the muscle pump that the night has stilled. 3 liters a day. Your body is still waiting for the conditions it was designed for. And here is what biology cannot erase. The lymphatic system has not changed in the 400 years since Aselli first stood over that dissection table in Pavia. The vessels are still there, running just beneath your skin. The 600 lymph nodes still filter every cell of fluid that passes through them. The thoracic duct still empties into the left subclavian vein with every deep breath you take. The glymphatic system still washes your brain in deep sleep. The 3 liters still need to move. The diaphragm still pumps. The body does not care about market forces. The body does not care about diagnostic codes. The body does not care about what was left out of the medical school curriculum. The body does not care about insurance reimbursement schedules. The drainage pathway is still there. It has always been there. It is there right now, waiting. A patient I will call Eleanor, 72 years old, a former librarian who had been prescribed 3 different fatigue medications across 6 years and told repeatedly that her swelling was normal for her age. Came back to my office 4 weeks after we identified her as a Type 1 and began the protocol. She walked in slowly. She sat down. She rolled up the cuff of her trouser. She pressed 2 fingers into the skin, just above her ankle bone. She held them there for 5 seconds. She released. The skin came back smooth. No indentation, no memory. The fluid was moving again. The system was draining. The exhaustion she had carried for 6 years was lifting in measurable increments by the 2nd week, an hour earlier in the evening before the heaviness arrived. By the 4th week, the indentation gone entirely. The body remembered what the appointment had forgotten. Your biology never forgot. Only medicine did. This content is for educational purposes only and does not constitute medical advice. Always consult your physician before making changes to your health routine.